Hi everyone. It's been about 4 years since I made my last video, so I wanted to make another one to give everybody an update about my health, as well as some insight into the long-term follow-up to my water-only fasting. So as you may have seen in my other videos, 4 years ago, I underwent a 14-day water-only fast, and I did this at an inpatient clinic under medical supervision. I found I had a lot of great results with that fast, and the fast itself was actually easier than I expected. But afterwards, I experienced a lot of struggle in reintroducing food. One reason for this is because I've been diagnosed with a condition called SIBO, or SIBO. It stands for small intestine bacterial overgrowth, and it basically means that the food that I'm eating, carbohydrates specifically, are fermenting in my gut. So I was having some gastrointestinal symptoms, but even more prominent was the neurological symptoms that were related to that. So I was finding that it was contributing to a lot of anxiety and depression, and when you live with a condition like SIBO that is chronic, you can treat it, but if you don't address the underlying root cause of the disease, it can very often come back as a chronic condition. So at the time, I was going through some pretty stressful events, and I was under the care of a conventional medical doctor as well as a naturopathic doctor who is also a licensed acupuncturist and is trained in Chinese medicine, classical Chinese medicine. And so the nice thing about this is that I was able to have the perspective of multiple types of medicine that with different philosophies, ways of looking at my condition. It wasn't just a treat the symptom kind of treatment approach that I received, which to me was really important because I wanted to address the condition long term. So after my fast, I was able to reintroduce food slowly, and I had a lot of success with that. And as I continued on what's called a SIBO diet, and there are multiple different types, I found that my symptoms started to return, and they were very ambiguous. So it wasn't as obvious to me that the condition was coming back because it was showing itself gastrointestinally as well as neurologically. And so over time, as we did all the medical testing that you would expect for somebody with quite serious and chronic symptoms, we found that my health looked great. Most of my tests came back showing normal results, and while that allowed me to breathe a sigh of relief, it was also extremely frustrating because I wasn't getting the answers that I needed, and I wasn't feeling better. So what did I do about this? I persisted. I continued to see the doctors who I trusted, and I switched doctors a few times to get alternative perspectives. And currently, or most recently, on my health journey, I was tested for SIBO again, and I received the results of these tests. It came back with a very high positive, and it was actually a double positive. So there are two types of gas that can be produced during the fermentation process, and it's hydrogen and methane. And this was the third test, in fact, that I had, but it appeared that this was the most serious positive result that I got. So my condition was getting worse even though I had treated it multiple times. So our suspicion was that it was undertreated. So, okay, what do we do about that? So what was really important to me was, again, to use an integrative approach. I feel like conventional medicine or allopathic medicine has a lot of great tools at its disposal when it comes to acute conditions or life-threatening emergent conditions, and I'm really thankful that that's available to me. However, for chronic conditions, it wasn't giving me the answers, as I said. So I went through another round of testing. We did all the blood work. We did a stool test. We did genetic testing. We did micronutrient testing, as well as heavy metal testing. And the thing that came back the most serious, as I said, was the SIBO. So the way that we decided to treat it this time was a multifactorial approach. So it began with a conventional medicine approach, which was antibiotics. So I did 2 weeks of antibiotics, an antibiotic called rifaximin, which is an antibiotic that stays localized to the gut, which is good for the reason that it doesn't exhibit the side effects, the negative side effects that other types of antibiotics have on people. And then after the 2 weeks of antibiotics, we went straight into a 3-month protocol of Western and Chinese herbal medicine. So right now I'm at the 2-month mark. I've completed the 2 weeks of antibiotics, and I'm just rounding out the 2nd month of the herbs. And the way that this is thought to work is as a follow-up to the antibiotics. So the idea is that you wipe the slate clean, and then you want to, of course, repopulate the gut in order to achieve a healthy microbial balance. So the way that we did this was to use several different types of herbs, and then we would alternate them every week or so. So I'm changing the herbs that I take every week in order to kind of tackle the bugs one by one, and we're kind of peeling these layers off one at a time. I'm doing this in addition to some serious diet work, and to give you perspective, at the time that I started my treatment, I was not able to tolerate any food by mouth. I was living on a really, really skim diet of like rice and cheese, and I was not feeling great. And it was only really out of desperation that I had reached that point. And so I knew something obviously needed to change. So over the first 2 weeks, I swapped that out for vegetables. And I followed the approach of the specific carbohydrate diet combined with the GAPS diet, which is the gut and psychology syndrome diet. And I also combine that with a low FODMAPs diet. So FODMAPs stands for fermentable oligo-di-monosaccharide and polyols. And these are all types of carbohydrates that are known to ferment if you do have this overgrowth of bacteria in your gut. And the idea is that if you can reduce those levels while you're treating with the antimicrobials, then you'll be able to achieve health that way. So the antibiotics sucked, but I felt better instantly. With the first pill, I felt like the gas that I was having and the bloating in my abdomen was reduced. And then over the next 2 weeks, it continued to get better, but it also really knocked me out. So I was in a state of probably really poor nutrition, because I hadn't been eating great, just to try to manage my symptoms day to day. And then after that, I was able to introduce food again, so vegetables specifically. So my approach was to begin with broths. So I started with vegetable and meat and bone broths, and then I began to introduce some boiled vegetables, and then I slowly began to introduce meats with it for protein, and then I moved on to more advanced foods such as raw vegetables and just increasing variety every few days, introducing another type of vegetable or another type of food. I've had a lot of ups and downs with this approach. I mean, it's really scary when you're feeling bad to expect that you're going to feel worse before you feel better. And I sort of had to do like a trust fall in a way. I needed to enlist the support of my family to help me out during this time that I knew I would feel pretty bad. And true to form, I did feel really bad, and it's been scary to go through that experience of wanting to feel better and trying to feel better and feeling worse. I will say now that I'm hopefully coming out the other side, I no longer am feeling the same level of heightened anxiety and depression. And related to that was a sensation of dizziness and just the severe fatigue. In combination with my treatment, I started to introduce some supplemental nutrients. So part of that was introducing vitamin D supplement, B vitamins, a B complex, B12, B9, as well as in combination with the herbs. So doing that at the same time. I'd say I felt my biggest spike of improvement was once I started introducing the B vitamins. And I'll just say that I had studied natural medicine for many years now, and many of these treatments were not new to me. This is not something that I had all of a sudden discovered and said, okay, you know, I need this. What really happened was that I wasn't able to tolerate the treatments in the past. So even though I was doing all these things to help myself, I wasn't able to even have the space, either financially or with my work situation. I wasn't able to reach a point where I could just fall and rest and recover. So I want to say that while it is important to have those things to get better, there are little things that you can do to keep yourself motivated to address your condition, and one of those is to just continue advocating for yourself. Something I've had to do for years and years, you know, for every time a doctor told me, no, there's no way, you can't be experiencing this. Here, have some antidepressants or have some anti-anxiety pills. Like that to me was not an acceptable solution to my situation, and I didn't want to put myself in a position personally where I would have to deal with withdrawals or some other type of side effects related to a medication. It's important to me that I actually heal myself from the inside out. And so even though I've had to suffer in some ways to do this long-term plan, I also feel like what I'm doing is giving me the best hope, because I've reached a point with medical doctors where they don't know what to do. And that's really disheartening to hear somebody who you want to trust with your health to tell you that you're crazy and to move on to the next specialist, because I've heard that so many times, and it doesn't give me a lot of hope. So I want to end this with saying that it's important to advocate for yourself if you feel like something's wrong, and if a doctor or another trained physician is telling you you're nuts or that you can't be experiencing what you're experiencing, don't believe that. That is not okay. And I do really truly believe that there is a doctor out there or a specialist or a physician out there who can help everybody. And so keep asking, keep looking, keep trying to find a practitioner who is able to sit with you and say, yeah, I see you, I believe your experience, and even if I can't tell you a diagnosis, I will be able to help you find a solution. So thank you for watching, and I hope that this has helped somebody, and feel free to leave a comment and let me know about your own experience. Thanks a lot. Bye.